Hey, welcome back. That was Sade with Kiss of Life right here on TRAXXfm, and you're currently hanging out with me. My name is KG. This is Health on TRAXX. All right, every Monday it's 11:15 all the way till 11:45, and of course in studio today we have Miss Rasveena Kaur, who's a pharmacist with the Cheras District Health Office. And today we are talking about the benefits and risks of painkillers. So now, of course, everybody knows painkillers are medicine that you take to alleviate pain, and we will be talking to her. So hello and welcome to Miss Rasveena Kaur. Welcome to the studio this wonderful morning. Hope you're having a good day today.
Hi, yes, I am. I'm great to be here today.
All right. So, you know what? Let's get on to the meat of the problem today. We are talking about painkillers, right? And there are many, many types of pain and many, many different medicines to treat them. So could you just tell us more about painkillers and what is it exactly that they do?
Okay, like you just mentioned, there are so many of them. I mean, there are many types of painkillers. In general, painkillers, or in medical term, we call them analgesics, are medicines that are used to treat pain. Generally, there are many types of painkillers available, and they come in various brand names. Mm-hmm. Okay, a patient can take them via mouth, which is as liquids, tablets, or capsules, via the back passage, normally as rectum, or suppositories, or by injection in medical settings.
Oh, okay.
Okay, and some painkillers are also available as creams, ointments, or transdermal patches. Generally, pain can be categorized into two main types, which is the acute and the chronic pain. So, acute pain is where it's associated with a tissue injury, after surgery, fractures, burns, inflammation. And chronic pain is the type of pain which is lasting more than 3 months. This is where you differentiate the type of pain and the kind of medications that, or painkillers that, you will take with it. And also, depending on the degree and the cause of pain, the pain experience can commonly be relieved by taking painkillers. There are many perceptions that taking painkillers can only bring harm. Well, this is not usually the case. Taking appropriate painkillers and following the advice of a doctor or pharmacist can help to control the pain and actually speed up recovery.
Oh, wow.
Yeah. Okay, this is because when there's injury, generally when there's an injury, the automatic healing response from the body is to produce inflammation and swelling. So at this stage, usually the analgesics or painkillers are prescribed or given to control pain and provide pain relief to the current situation. Yeah.
And as you mentioned it, painkillers are analgesics, and also they come in multiple different forms that they can be used on the patient. And also you mentioned acute pain and also chronic pain. Now for our listeners out there, acute pain is pain that can be caused by trauma. And a sudden onset of pain, and chronic pain is something that you will have to live through after a long, long time.
So after a longer duration of time, like about 3 months or so, then we normally generally define it as a chronic pain.
All right, lovely. Now, what are some of the different types of painkillers available out in the market right now?
Painkillers can be broadly categorized into two groups, which is opioids and non-opioids.
Okay.
So non-opioids includes paracetamol, which is largely available at mostly every outlet.
And also Malaysian favorite.
Yes, it is. And of course, Nsaids. Nsaids is something another type of medication where you can get it over the counter, or of course also by prescription by the doctors. Okay, and another one is the opioids. Opioids is usually, it's not usually, it has to be via prescription.
So these are things like morphine and the such.
Yes, morphine, codeine. Opioids itself has got this weak and strong opioids. So that is where it differs. Not generally, when you say weak, it doesn't mean it's weak. It's actually very strong to treat chronic pain. So the stronger opioids are generally given in hospital settings, with very stringent monitoring.
In the event of major trauma, like
accidents and all that. Yes.
All right. Yeah. So how do painkillers work? What do they do within the body itself?
Okay. In terms of paracetamol, there is no exactly, or there's no established pathway that has shown real results or how it works. Okay, so it is said that it works by blocking a COX enzyme. It's called a COX enzyme, a cyclooxygenase enzyme, in the brain and spinal cord. So it kind of dulls the pain receptors in the brain. Okay? As a result, you feel less pain. But paracetamol is the mildest.
Yes.
And when we talk about Nsaids, okay, Nsaids generally, it's abbreviation for non-steroidal anti-inflammatory drug.
Okay, that's a long one. We'll stick with Nsaids. Okay.
Yeah. So Nsaids, as the name itself mentions, anti-inflammatory, non-steroidal, anti-inflammatory. So they also react with the COX enzyme. They further reduce a chemical called prostaglandin. So whenever there is an injury, prostaglandin is the one that irritates and causes inflammation. In simpler terms, I'll put it that way. So they react towards the prostaglandin to reduce the inflammation. And therefore pain and inflammation, especially inflammation and pain.
Okay, so essentially there's two ways that they seem to work. One is by targeting the site of the injury itself, and another one is blocking the response from the to the brain, as you said earlier. Am I in the ballpark?
Yes, you are about there. Yes, generally, any pain felt, it's the signals are sent from the site of touch. Imagine if you accidentally touch something hot or carry a hot pot or something, it takes time for the message to go through the brain.
Okay.
So there's a pathway for it, and then that is where usually the blocking happens.
Okay, wow, wonderful.
Yeah.
I'm learning a lot today. and also, painkillers, usually some people like to self-medicate, but of course, in what circumstances are painkillers actually which painkiller is commonly prescribed, Ms. Rasveena?
Okay, it depends, the type of painkiller the doctor will prescribe, or if you were to go to a pharmacist at the community setting, it depends upon a few things. First of all, the type of pain, like I was mentioning previously, either if it's an acute pain or a chronic pain. Okay, secondly would be the underlying medical condition. So there are, of course, a certain kind of medical conditions that should not say avoid, but you should take it for a short period of time, or needs a certain percentage of adjustment, especially like people who has got renal problems, those kind of asthmatic patients, example. Okay, also the pain severity. Also depends. Okay, in Malaysia we have got this pain scale. Recently we're using in every hospital and hospital's government setting. So normally we ask a patient, what's your pain scale from 1 to 10, from 0 being less painful to 10 the most. So according to that, we also depend on the class of. We can suggest the kind of painkillers that you could use, and of course the possible side effects of the medication.
Okay.
So like everything, everything has got side effects, inclusive food. Generally everything has side effects. So we need to see which is the best or safest option for the current existing patient. As what is safe for me may not be safe for you. You may have different underlying conditions that would differ. Okay, in that terms, paracetamol is the safest. And it's not too serious. I mean, it's used for pain that is not too serious and without inflammation. I'll just give you a basics,
Yeah.
So if you will come to me, I would say okay, I will ask you example at the community setting in the pharmacy. So is there any pain or is there any inflammation? Generally when you over the phone it's a bit difficult, but when you look at the condition, is there a swelling, is there redness? In that case, if there's none, paracetamol is all right.
Yeah.
Okay. Paracetamol can help in actually, you'd be surprised, it can help in quite good. I mean, it has got good pain dulling properties, like toothaches, actually, backaches. It does help. Okay, some people with bad period cramps. However, if there is inflammation involved and there is pain at the same time, they are not really suitable. They don't work. They don't work.
They don't work to help your inflammation at all.
Not at all. It's just for the pain dulling effect only. So in that case, you will need the Nsaids, like non-steroidal anti-inflammatory Yes, those they would help to reduce the inflammation at the same time. Actually, it just comes back to the basics. Okay, now you see if there's an injury. Okay, let's talk about acute pain. If there's an injury and then, or maybe you were playing football or you were carrying weights and suddenly you probably would have pulled a muscle, or maybe there is a certain injury. Normally, the response to it is the body's natural response is to produce inflammation.
Yeah.
Okay, and inflammation is so that there is
more blood.
Yes, more blood supply to for all the nutrients, to be at that current spot, for quicker recovery. So, being said that, when you take paracetamol, because it doesn't help with the inflammation, it won't help that inflammation, that spot.
It won't help the healing, but it just stop the message from getting...
Even the pain will be mildly or dully reduced because inflammation is there. As long as the inflammation is there, the pain will be there.
Of course.
Yes.
Yeah.
So, henceforth, that's why you have to take this NSAID to reduce the inflammation. Yeah.
And as just a continuation of what we were just talking, in what circumstances are painkillers usually prescribed?
It goes back to the same, actually, whether it's an acute injury, whether it's a chronic one, or depending on the severity of the inflammation, whether it's just localized or or of course it is a back pain or if it's a knee,
knee pain, I can understand that. Well, anyways, Ms. Rasveena, we're going to be taking a short break, and once we come back, there's more to talk about, especially all about the painkillers, because I don't think 30 minutes are enough to talk about painkillers today. But you know what? We're going to try to cover as much as we can. We're going to be back right after this song. This is Queen with The Show Must Go On, no matter how much pain you're in. All right? Right now, though,
direct to your home, in the car, or at work with 50,000 watts of power and no satellite dish required.
TRAXXfm.
And as you know, the show must go on, then the show is Health on Tracks. Right now with me, KG, and of course our esteemed guest, Miss Rasveena Kaur, who's a pharmacist with the Cheras District Health Office. We are talking about the benefits and risks of painkillers, and of course we are coming on to our next question. Now, Miss Rasveena, how do we take these painkillers?
Okay, people who are in pain at all times are usually recommended to take these painkillers regularly. Okay, for example, to those who have been prescribed paracetamol, we'll typically take it 4 times a day. 4 times a day does not mean I take it now and the next 2 hours I'll take another dose and I don't feel better, another dose. 4 times a day means generally 6 hours apart. You take 24 hours, you divide by 4. So until the pain is better.
Oh, okay.
Yes. Otherwise, they will need to take painkillers as and when needed. Normally, when you go and you meet a doctor and or a pharmacist and you tell them that you have certain pain, and they'll tell you, okay, you take this example Celebrex. You take it every day. You take paracetamol when necessary, meaning that Celebrex, because everyone all the medications, they do have their maximum dose per day to relieve the effect, or so that they can give you the optimum benefit. So, example, if you're taking Celebrex in the morning and the next dose is due 8 o'clock at night, you take it in the morning 8 o'clock, and suddenly the pain starts to creep in about 2 o'clock or 3 o'clock. That's when you can take paracetamol for added advantage, but it does not mean that you should take Celebrex at a time.
Yes.
You see, so it's supposed to cover 12 hourly. Yes, that is how you usually take it, and the length of treatment depends. It depends on the severity of the pain. If it's an acute pain, like I told you, it could be, generally, when you you pop in a tablet, the pain relieving effect is often seen in the next half an hour to 1 hour. Okay, for the pain to be completely gone, if it's not too severe, it could take up to 1 week. However, for anti-inflammatory effect, it can take up to 3 weeks. Okay. That is why sometimes when you go over and you are prescribed Celebrex and they tell you that take it daily, and you be questioning yourself, I'm not in any pain, why should I take it? Yes, right? So actually the effect here is to reduce inflammation.
I'm laughing because I've done that before. Yeah, that's the thing. Sometimes, we believe that we know better. Yeah, yes. Unfortunately. Yeah. And that's the thing, like antibiotics, painkillers should also be taken for its own cause, right?
Yes, exactly. And normally it will be indicated very clearly to you. Like, if you go to clinic, it's written on an envelope, take makan bila perlu. Or, if you go to clinic kesihatan, they'll tell you, okay, this you take daily, and then this one you take when necessary if there is pain.
Excessive pain.
Yes, excessive pain, example. It's just a supplement sometimes, So if you are, already experiencing inflammation, and if you don't take your painkillers as prescribed, because you go and see the doctor because you have a problem, isn't it?
Yes, absolutely.
And you don't follow the regimen, and obviously, the treatment is interrupted in some way or another. Sometimes it exacerbates the pain, or the condition.
Oh, wow.
Yes. In certain conditions, like example, if you are post-surgery, a post-surgery, maybe ACL, example. So, as a, pain, for the pain management, they give you Celebrex, and you'll be like, okay, day 5, day 6, I can, I feel better, I don't need to take. But no, actually, whenever you cut something or if there's an injury to a tissue, there will be inflammation. You have to address inflammation as well. It's not just the pain that we're looking at. It's a deeper connection with the inflammation and the pain. Yeah, so mostly it's that way.
All right. So, and length of treatment for any and all of these painkillers?
Generally, if you were to go to any clinic kesihatan, acute medications are only for 5 days by right.
By right?
Yes.
Wow,
okay. Now, I will just give you another scenario, very simple scenario. If you often get headaches, okay, or you casually get headache and you pop in 1 paracetamol or 2 paracetamol as per adult dose, okay, and then you get better. But then again, if this condition is reoccurring, you keep taking it every day, you don't take it and your headaches come back, this is where people don't realize you'll probably be masking an underlying condition.
Yes.
True. So if it's a persistent condition that it requires you to keep taking the painkiller without prescription or without consultation, then you should go and get it checked up. What is actually causing the pain? Because when you take a painkiller, of course, the pain disappears.
Yeah.
But then again, the underlying condition may be there. Same goes to if you have an ankle injury, and you be like, oh, it's going to be fine in a few days.
Yeah.
You don't go and get it checked and all that. Okay. Yeah. And then without realizing, you tend to put more weight on the other foot.
Yes, you change your gait.
You change your gait, and then you start getting long term or down the road, you start developing other problems like backaches, leg cramps.
Yes.
And then you also realize that the soles of the other shoe is probably more worn out than this one because you're using way more, force on the other foot. But you didn't address the actual problem, which is the right foot with the right ankle, and that is only be solved if you go and see a doctor. Get it consulted and see how you manage that problem. Yeah.
And get it sorted out.
Yes, get it sorted out.
I feel like this is very personal to me because I do have an ankle injury per se, and I need to go see a doctor about that in the future. Now, of course, painkillers, as good as they are for the body, there's always the benefits and the risks. So what are the benefits and the risks of painkiller?
Okay, each medicine has its benefits and its risks. So, a certain type of pain responds better to a certain type of painkiller. The point to note here is that what may work for me may not work for you.
Yes, that's true.
Okay, so let's take paracetamol as an example. Okay, as I've mentioned a few times, paracetamol is the most commonly used medicine for pain relief. And for most people, when used as indicated, it is actually safe to reduce fever and many kind of pain from mild to moderate. Okay, it could be backache, toothache, sprains, arthritis, or even menstrual cramps. Okay, the side effects are rare for any medications unless taken incorrectly or not as indicated or self-medicating because you have seen it on any social media or somebody's doing it, or you saw that your brother is taking it and I should take the same dose. No, it doesn't work that way. Okay, so one common side effect actually that is associated with any medicine, not just painkiller, is actually allergy reaction. It could happen with any medication, okay? So, side effect is actually the effect experienced when the prescribed medicine is taken in an incorrect dose, whereby an adverse reaction is an untoward effect due to the, hypersensitivity towards the content of the medication. So, if at all, taking paracetamol again, reactions such as skin rash or shortness of breath, itchiness, face swelling may occur if you're allergic or hyperallergic to the contents in it, okay, or the formulations or the excipients, okay. As per se, like paracetamol alone, okay, they generally it is original product, okay, Panadol. But then again, when it becomes generic, okay, it is still paracetamol, but the excipients may be different. The bulking agents may be different. Not necessary that you be allergic to paracetamol. It could be the excipients or the bulking agent. So, that is where, we should not make our own assumption that I'm allergic to paracetamol.
Per se.
Yes, as per se. You should get it checked. Is it really paracetamol? Is it other, other factors in it?
Absolutely.
And then another benefit is that if it's paracetamol, it does not cause stomach upset or heart problems.
Oh, okay.
Yes.
Yeah.
So it is a good alternative as pain as a pain relief for those with heart disease or who's got gastritis or stomach issues. And it is safe and effective when you use in a recommended dose. And same goes to other medicines. So when a doctor tells you or a pharmacist tell you the maximum is 4 grams a day, we should keep it in the limit. Yeah.
Don't push it. Don't self-medicate.
Yeah, so it's only when you take it overdose or okay, I'm supposed to take 4, but it's okay if I take another 2. It's not going to make any difference.
Yes.
That is when the side effects appear.
Absolutely. Yeah. Thankfully, I've only taken 2 per time. Every 2 hours.
Yeah.
Is that right? No? 6 hours, guys. 6 hours is the minimum amount of time you need to wait between each dose of a paracetamol. Now, of course, we'll be talking about paracetamol later as well. But right now, we are going to be talking about Nsaids. You mentioned Nsaids as well as opiate painkillers. Now, this is the heavy stuff right here, isn't it?
Yes, that is.
So could you tell us more about that?
Okay, it's a different whole scenario actually. So there are approximately 20 different OTCs and prescription of Nsaids available. Okay, Nsaids are generally safe. They're quite safe in treating mild to moderate pain, and they rarely have side effects. Like I mentioned, it depends when you take over a short period of time in a prescribed dose. Of course, they are rare, minimal. Okay, most people who take anti-inflammatory, at least in short term, have reported no side effects, minor ones. Generally, when you go, they're also prescribed or directed to take short course of anti-inflammatory for all sort of painful conditions. So although being said that, Nsaids are not suitable for everyone, especially the types. It depends on patient's medical condition. Like I said, just now you asked me, how do you choose which kind of painkillers to give? Yes. So people who has got gastritis, it may aggravate. It depends. And so also got 2 types. One is the COX inhibitors and the other one. So the COX inhibitors, which is very common, Celebrex, Acoxia. Those are generally well tolerated in this kind of population. However, it's best to get consultation first, because it depends still again to the existing medical conditions.
Absolutely. Now, Of course, we talked about the benefit. Are there any other risks of Nsaids and opiate painkillers other than upsetting people with already underlying issues such as gastritis and the such?
In terms of Nsaids, normally they irritate. Allergic reactions, of course, possible. Okay,
but they're not common, right?
They're not common. Okay. Yes, it could happen from one individual to another. There are people who are generally, as per se, allergic to Voltaren, but they can take other like Celebrex. It's fine with them. Other side effects would be gastrointestinal disturbances. It may cause. So that is when it comes. Some people will say, if it's mild. You could take it to food. Of course, there are preventive measures for those kind of effects. Like example, if you come and tell me, and I'll ask you, you say I want a painkiller, and I say okay, Voltaren suits if you want that, okay? And then I will ask you, do you have any gastritis or do you have any gastric issues? And you'll be like, no, I have a little bit, not too bad. So this is best, that's when you take it with food or after food, not before food. When you take before food, one is the absorption is not as great because there's too much of gastric acid in it, and secondly, it will irritate the stomach lining.
Absolutely.
Okay, and in terms of opioid, generally, yes. Opioid, they are generally mildly sedating. So you're not supposed to be driving. You're not supposed to be, doing, using heavy machineries because it may impair your thinking ability, and all that.
And also your response to the such. Now, so Nsaids and opiate painkillers are always given under consultation and also observation, right?
Yes, that is right.
Okay, and I need you to break a myth for me. This is a myth that has been passed down, I don't know by how many generations. Is it true that you cannot drink gassy drinks with paracetamol?
It is best to avoid.
It is best to avoid.
It is best to avoid. Any medication, as per se, should be taken with only plain water, no milk, no coffee, nothing. If you want to have something, actually, is it paracetamol, as I've mentioned, is quite safe.
Safe.
Yes, it is safe, but we should not purposely aggravate the matter, and also help to help its absorption. All you need is plain water. We would not know how is the absorption, taking with gassy drinks and caffeine. It may just, lead to side effects that we do not want.
Yeah.
So if you want to, if you're not feeling too well, okay, best is obviously have something very light. Okay, take your medication. If it's stated after food, okay, and wait about half an hour to 40 minutes. You can have your gassy drink and whatever else that you want to have.
Okay, seems like my mother was right. Okay. She said, don't drink that with that. Okay. Well, Ma, thank you. And anyways, right now, before we end the show, is there anything else that you would like to add on for our listeners, your advice or your take-home message?
Okay, as we all know, medicines are used to treat, prevent and control certain disease or conditions. Okay, all medicines must be registered with Pihak Berkuasa Kawalan Dada, or known as PBKD, with Ministry of Health. Okay, this is to ensure safety, quality and efficacy of the medication, and also to make sure that we're taking genuine products. Okay,
true.
So painkillers are available in many, basically everywhere, okay, in government clinics and hospital settings, yes. But convenience stores are only allowed to sell paracetamol. You must understand that. Okay, if at all is any other painkiller, Nsaids, all that, I would not suggest for you to buy, because I do not know of the authenticity.
All right,
Yes.
so that is a very good PSA right there.
Yes, it's just paracetamol alone. Like I've mentioned also, we were discussing earlier, right? Like, okay, a paracetamol, you need to know, okay, we should not go by brand name. Now, you may take Panadol, I may take, Tylenol or something like that. But at the end of the day, the content of the medication is paracetamol. Same goes to, any other painkiller. So, if you were to go to any health care setting and you tell them that, okay, I'm taking it's actually Voltaren, but maybe you take a different brand, but the content is the same. So when you don't you don't tell the personnel in front of you that you have already been taking the product, they might not know, and they'll be like, okay, I'll just give you the same product, and you probably be overdosing yourself unnecessarily, causing side effects which shouldn't have happened in the same place. So it is very important for us generally as consumers. You should be able to look at the small encrypt, when you don't look at the brand can be any,
Yes.
We could just come up with a new brand tomorrow, but the content, the ingredient, the active ingredient and its dosage is the one that matters the most.
Absolutely.
You need to look at it and you need to know, okay, I've taken this, and when you go to the next setting, you can tell, I have taken this, it has either helped me or not helped me. Okay, so I would like to enforce again, the public is advised to obtain painkillers and other medications from authentic and reliable sources only. Okay, not online, please.
Yeah, don't buy them online.
Okay, and of course, some medications they require doctor's prescription and monitoring, as in sense of opioids. Some Nsaids as well. Okay, depending on the condition. Painkillers should only be taken when experiencing pain.
Absolutely.
Okay, unless indicated, unless, like I was mentioning earlier, unless you have a chronic disease and we want to treat that, underlying inflammation or other problems. Okay, and if pain persists or becomes worse, okay, do not take it lightly. You must understand, if you are taking, if you are self-medicating, if you think that this has worked for you before and it will work for you now, but then again, in the next 1 week, your pain scale remains to the same figure. It doesn't go down. It doesn't get better, or your joint swelling hasn't gone down. I would really suggest, I would tell you seriously to please go to the nearest healthcare and, healthcare setting and get it checked up. We would not know what is causing it. You could be masking some other problems. Okay, and so avoid continuous intake of Nsaids also in a high doses, without supervision. This is because we are not, when you're not very familiar of the effect, and you will not be familiar with the side effect as well. It may feel mild to you, but eventually it might just build up to become a severe one.
Absolutely.
Right? And I think if it comes to this pain, I think it eventually all comes back to you. I would not say that taking painkiller is bad. It is not.
It's not.
So everything has got a balance. If there is pain and it's reducing your quality of life, of course you can take it. You can discuss this with your healthcare personnel and make it better and reduce the pain and improve quality of life. At the same time, treating the actual problem. Okay, if the audience or anyone at all has any questions or inquiries regarding any medications, there is a hotline that you can call, National Pharmacy Call Center. It's called NPCC. You can reach it at 1-800-88-6722 from Monday to Friday, working hours only.
Okay.
Yep.
And now, of course, earlier on you mentioned the paracetamols are very mild, but that is not a call out to all our listeners to pop paracetamol all the time. Only use it when you need it.
Yes, that's correct.
All right. So guys, treat painkillers with respect, and of course, any pain that you have, consult a doctor, consult a physician first, or even if you have any questions, you can call NPCC. They have their own hotline right now, 1-800-6722. Or you can definitely go to a local pharmacy and ask them if the medicine that you need is suitable enough for you.
Yes, that's correct.
All right. Thank you so much, Miss Rasveena. We had a wonderful time with you. And of course, I learned a lot as well about pain, as well as painkillers. And we want to have you again in the future, hopefully to talk more right here on TRAXX. All right. And with that, a big thank you to you.
Thank you.
All right. So that was Miss Rasveena Kaur, a pharmacist with the Cheras District Health Office. We talked about the benefits and risks of painkiller, guys. If you guys have any questions at all about painkillers or any medicine that you need to take, you can definitely call the hotline at 1-800-886722 NPCC. All right, Mondays to Fridays, 9 to 5.
Yes.
Alrighty, right now though, I think this song will be suitable because this song is called Painkiller. Right on TRAXX.